Welcome back to Newsmax Now. Thanks for sticking around. Last month, former President Jimmy Carter revealed that he is cancer-free just months after doctors predicted the tumors that spread to his liver and brain would kill him. Now, many were surprised by the news, except for the doctors who treat cancer. The reason why? Doctors treated Carter with what some call a breakthrough in cancer treatment. Earlier, we spoke with Newsmax and Health editor Tate and author of the Baby Boomer Survival Guide about the drug and what it can do for cancer patients.
It's a new immunotherapy. It's called Keytruda. It's a drug, and it works in an entirely different way to combat cancer than conventional therapies. Treatment for cancer typically involves surgery to cut out tumors, radiation to burn them away, and chemo to poison them. But those treatments do cause side effects, and they depress the immune system. This drug moves in a completely different way, and it boosts the body's own natural defenses to fight cancer. And to my mind and the minds of many experts, it's really the new wave of cancer treatment. It's not a cure, but it's the next best thing.
How does it work?
Well, it basically takes the brakes off the body's immune system. Tumor cells have the ability to kind of compromise the immune system, throw the brakes on it so that they can evade the immune system. But Keytruda, the drug is called, it takes the brakes off the immune system so that it can directly target tumors. Right now, it's licensed. It was just approved by the FDA primarily for lung cancer, but they've also found it to be beneficial in the treatment of skin cancer, prostate cancer, and leukemia.
Right. I was going to ask you, does it work for all forms of cancer?
Right now, the licensing and the studies have been really limited to only a few types, but it works by such a way that it could work theoretically, at least, on virtually any kind of cancer, because what you're doing is you're boosting the body's natural defenses to fight tumors. So the hope is that this drug and others like it will be really the wave of the future. And
there are others like it?
Right. There's a handful of other drugs like this that are in the pipeline. There's also a variety, they're actually called checkpoint inhibitors, but there's a variety of other techniques that use vaccines, monoclonal antibodies that fall into this category of immune therapy. The idea is getting away from treatments that harm the body's healthy cells while going after tumors and actually boost the natural defenses to target cancer.
Now, you mentioned the FDA approved this. How readily available is it?
You can get it now. If you have certain kinds of cancer that are tied to a very specific lung cancer, genetic defect linked lung cancer, you can get it now. I do believe there will be off-label uses of this drug as well. So if you're someone who's looking at cancer, it's worth asking your doctor about this particular drug, Keytruda, and other immunotherapies to see whether you're a candidate.
We're always talking about Obamacare and insurance costs. How expensive is this treatment?
Well, like other cancer drugs, it's costly, but this is something that we're working out. There are drug assistance programs that can help you get care. Your insurance company will cover it because it's FDA licensed. The question is how much and what kind of a policy you have, but there are ways to get help. The place to start is really to talk to your doctor who can direct you to those resources.
Okay. All right, Tate, thanks so much for joining us.
My pleasure.
Always a pleasure to have you.
Thank
Again,
you.
the name of the book is The Baby Boomer Survival Guide. Well, they say laughter can be the best medicine, and we couldn't agree more. Hope you enjoy a few laughs during this Friday edition of your Headlines and Punchlines.
I read that the State Department is having to hire more staffers to review all the requests that are being filed for Hillary Clinton's emails. Or as Hillary put it, see, I'm creating jobs already. I told you.
Dr. Ben Carson appeared on The View this morning, and when asked afterwards what he thought of The View, he said blurry. Always blurry. My answer for all things is blurry.
Terrorists win when we allow them to disrupt our way of life. And we are afraid, it's true. I'm not going to lie, we have to try and live with that. And if I was Obama, I wouldn't let them disrupt my way of life. I mean, look at what he's been doing this week. There's baseball in Cuba, dancing with a beautiful woman in Argentina. And this is true, he even appeared on Cuba's #1 comedy show.
Obama, Obama, so nice you came to Havana.
And speaking of the president, we still want to hear from you. What do you think about the president saying that there's little difference between communism and capitalism? You can tweet us your thoughts or leave us a comment on our Facebook page. We'll be right back.